We are going to talk about round ligament pain during pregnancy. So if you're suffering from round ligament pain or pain that you're feeling in this area, then you might have round ligament pain. This can happen at any point in your pregnancy, regardless of the size of your body. So if this pain is happening to you, a lot of times it can feel stabbing or sharp. Combining my words today. It can feel stabbing or sharp, but it can also feel like saran wrap. So when you go from like a sitting position to a standing position, it feels like it's just not letting go, like the saran wrap is kind of stuck. So those are how people describe it. It can usually be one side or the other, or it can be both sides. So right now you're gonna imagine I'm pregnant here. Here's my belly. A lovely relief technique to help treat the round ligament pain is to take your hands and come around your belly. If you can't reach the bottom of your belly, you can have a partner do this for you. You're gonna bring your hands underneath your belly, right above your pubic bone, and lift up towards your head. Just you holding baby and supporting the belly is gonna help slack those ligaments. So then the round ligaments themselves won't have as much of a pain response. So this is a really nice technique just to give yourself a little bit of relief. If you're experiencing pain when you're going from sitting to standing, one thing you can do is before you stand up, put your hands underneath the belly and then stand up. And then you're just helping support those ligaments again. So that will help reduce the pain. So just a couple tips there. The other thing that you're gonna wanna learn how to do when moving your body in space, we call it blow before you go or blow as you go. What this means is if you do anything with exertion, you're gonna exhale, shh, using an SH sound. That helps activate what's called your transverse abdominis muscle. So if I move to the side, right here, I'm not activated, but here, I'm activating my transverse abdominis. So imagine I'm pulling my pubic bone down here, up to my sternum. So we have you do that with a breath. So we combine this blow as you go with what's called the transverse abdominis contraction. So you're gonna go shh. You can keep it engaged as you go through the movement. So let's go back to my example of sitting to standing. A lot of times this is where people have pain with round ligament pain. So when they go from sitting, you're gonna start the shh at the bottom when you're sitting, and then as you stand up, you're gonna shh. So you're decreasing the abdominal pressure and the downward pressure on the round ligament. That's also gonna help take the pressure off of the low back, off of the SI joints, and off of the pelvic organs. So that's gonna help reduce a pelvic organ prolapse. That's where your organs can get a little heavy during pregnancy and the organs start to shift down into the vaginal canal. You can Google that. But that's gonna help prevent that. So work that into your daily routine. Blow as you go for any discomfort. A couple stretches that are gonna be vital to helping with the round ligament discomfort. The first is a hip flexor stretch. So keeping that transverse abdominis turned on, so engaging that muscle in the belly, you're gonna bring the leg behind the body and just kind of lean forward. You should be feeling this in your hip flexor. When you do a hip flexor stretch, you're helping that whole area open up, and that stretching that should take pressure off of the round ligament. If this is too uncomfortable, you're gonna lift belly up as you go into this stretch, and that will be supportive for you. So you can hold that 60 seconds, do that each side, do that a couple times a day until this pain goes away for you. So that would be my favorite stretch. Second favorite is gonna be to do an inner thigh stretch. You can go use your countertop at home. This will be a little higher at home, and just kind of rest your arms here, and then you can shift your butt to the opposite back wall and get a nice inner thigh stretch. Again, you're gonna wanna keep baby engaged, so keep that muscle engaged so you're taking the strain off the round ligaments. You can, again, each side for 60 seconds, getting an inner thigh stretch here. So I'm kind of twisting my pelvis and getting a nice inner thigh stretch. And I like to use a counter to support the upper body during pregnancy. If that's not an option, you can use a wall and just shift the pelvis. And again, feeling that nice inner thigh stretch, or shift the pelvis here, getting a nice inner thigh stretch, feeling it up on the upper inner thigh. So those are a couple stretches there. The third stretch that you can do is called a flat back stretch. This would be hands on the wall, bringing your butt to the back wall, and just stretching back, stretching the hamstrings. It's almost like a modified downward dog, and we're just stretching the attachments to the pelvis that is going to take pressure off a round ligament. So those are just a couple techniques that are going to help you manage this round ligament pain. I'm going to finish with giving you a taping technique that is really helpful for managing round ligament discomfort. So you're going to see my belly for this. We're going to use what's called KT tape. Any form of kinesio tape will do. Depending on the size of your belly, you might need 1 strip, you might need 3, might need 4 or 5. It's all about your comfort and where you feel the most supported. So so here we go. Taking hands and elevating, this is the move of the tape. We're going to use the tape to mimic what the round ligaments do. So when you're pregnant, depending on how far along you are, your belly is going to be of different heights or different, sticking out different sizes, right? So I'm putting the tape down. There's no stretch on this tape right here. Then I'm going to add a stretch. And if this is 100%, I'm going to go to about 50. And then I'm going to use my hand and lift up my belly. And then I'm going to put the tape down here with no stretch at all. Now, pregnant skin can often be very, very fragile. So if you're allergic to adhesive, or you just feel like this is itchy for your skin or irritating, you need to remove it right away. When you take it off nice and slow. You do not rip it off like a Band-Aid. So again, no stretch on the tape when I initially put this down, kind of right at the midline. Now I'm going to add about, that's 100, I'm going to go to 50, lifting up. I'm going to then put it down. And this is going to give you some nice relief throughout your day. Everyone can tolerate the tape a little bit different. So you might be wearing this tape for 1 day, you might only last 5 hours in it. Some people can wear it for 3 to 4 days. So just monitor your skin. Any redness, irritation, or annoying sign of it, you need to remove it right away. All right, I hope this is helpful. If you need more advice to help manage your round ligament pain and cure it, definitely get in touch with a pelvic expert physical therapist. And if you don't have one in your area or you want to prep for a vaginal delivery, look into our birth prep program online and we will be happy to help you get there. Take care. Okay, thank you.
Yeah.